Good day, students. This video is exclusively for the exam going students. R.A.T.S for MD, and it shall include practical pathology, vivacy, and pedagogy. Let us see how we shall handle it. This is a view of the mark distribution for the various exercises. This can be varied from center to center or from examiner to examiner. But overall, it can be a format. There shall be an assembled autopsy, gross specimen, histopathology and cytology staining techniques, sometimes histopathological techniques also. There can be hematology and cytology slides, all on day one. And this will be the total marks for it, the distribution of marks. On day 2, we shall be having a clinical case discussion, histopathology slides, OSPE, and the total marks shall amount to this. This shall be the distribution. Following which there can be a pedagogy and finally a grand viva. The mark distribution is as given in the boxes. Totally, the practicals will carry about 200 marks, of which the student should score 50%, that is 100 marks. Pedagogy and viva are adjustable. The marks can be as high as 50 or as low as 30 or even 25 as the examiners come to a conclusion. Now, we shall wander through the various practical sections. First one shall be an autopsy. These are some of the salient points of the autopsy which I should bear in mind as a student. First, let me be very happy that there is no complete autopsy. Today we have got what is called an assembled autopsy in most centers. If there are 4 or 5 candidates, they are given the various diagnoses which is picked up by lots and the specimens given accordingly, which they will have to examine and finally arrive at a diagnosis. Various questions shall be asked about the identification of the cadaver, who gives permission, who does it, and how do you open the various organs, what is the importance of the autopsy, and so on and so forth. And we are supposed to know the basic weight of the organ, the fundamental anatomy, not as accurate as the first year anatomy. And some of the lesions, we will have to explain or give a differential diagnosis before we arrive at a final diagnosis. The kidney contracted, for example, ulcers of the intestine, and so on. And even these questions have been asked earlier. What is a petechia? What is a purpura? What is an ecchymosis? Where all will you give the bits from? And what other investigations can you do? And there will be such a plethora of questions which we shall definitely not be prepared for. Don't worry. The dead are teaching the living. And look at this picture. Those days, the cadaver was the Bible. And today, we shall be asked some questions regarding the identification of the cadaver, what are the types of incision, types of autopsies, where do you do the autopsy, who gives the permission, and who is permitted to do an autopsy, what is a medical autopsy, what is a medico-legal autopsy, and so on. And also, based on the specimens that we have got, there can be a plethora of questions that can be thrown at us. So we will not be bewildered by it, but then we shall be somewhat mentally prepared and psychologically prepared for such assault. This is another way that I compiled. The autopsy, it can be, the questions can be history-wise, based on the history that I have got, or it can be based on the procedures that could be done. What is the system that was affected? What are the diagnoses? What can be the other changes in them? It can be the organ. What are the other changes you can find in that organ? Disease-wise, etc. Identification, permission, as I mentioned earlier. And finally, what is the ultimate cause of death? After all, that is supposed to be the purpose of autopsy. And there are a beautiful list of books which have stood the test of time. Vagoliker and Langevar. It has come out recently. Ludwig, a beautiful book. Shamim Sharif, Otto's Affair. Your own logbook that is important for you to follow, because in that the various systems and the organ details will be there. Game is one that I have recently added to the list. This is one of my channels, Gross and Microscopy Explained. And we shall be continuing with the pattern of practical. The next is clinical pathology. Please do remember that I am not covering each of the section in completion, whereas I am just trying to give you an outline. In the case of a clinical pathology, there will be a case history, and you students by lots might be asked to take one particular history, or if possible, a patient might be provided from the clinical side itself, so that you ask the history and then you compile it, present it to the examiners, and they will ask you what are all the probable investigations that you would like to do. And finally, they will ask you to do a set of investigations. Generally, we should be prepared for a complete hemogram. Second one, the basic biochemical investigations. Third one, urine examination. Fourth, some common tests like the blood grouping, Coombs test, etc. You may be asked to perform certain tests. Sometimes you will be asked to interpret the values that can be obtained from the biochemistry department or so. Finally, you will have to correlate and then give a report. But please be extremely careful. There are some examiners who are pioneers and pundits in clinical pathology who own a lab or are directors of laboratories. And to them, we cannot say that I do not do microbiology, I do not do biochemistry, etc. They say that the pathologist is the ultimate authority. Of course, that is the rule today. And you are supposed to be knowing everything. And also have an idea about the equipment, the various equipment that could be used. We can be getting questions on the equipment. What is the mode of purchase? What is the kind of reagents that you are having? And so on. Finally, the diagnosis, of course. This is again a list of books which I would refer. There are a lot of other books available. Whatever be it, my dictum is do not change the book, but you people can always go back to them if time permits. Game is one that I'm trying to introduce to the students of pathology. Gross specimens can be kept. It can be either part of an autopsy or it can be the gross specimen itself. Sometimes, okay, you're getting a group of lymph nodes, fine. And the student gives the diagnosis of a non-Hodgkin's lymphoma. And these are the words of my professor when I was a senior resident in Japan. How are you confident of making a diagnosis in 5 minutes when we struggle for days? Many a time you people would have noticed that the senior professors do not come to a consensus. They do an IHC and then finally they come to a diagnosis. In such a case, if I give a diagnosis of a non-Hodgkin's lymphoma straight away, it means two things. One, I have already known the diagnosis, or two, somebody has helped me in the examination hall. Dear students, just a small story to explain our limitations. There were two people, knowledge and wisdom. They met at a party. Knowledge was very proud, and then he said, "Do you know how much I know?" Wisdom was quiet for a moment and then said, "Do you know how much I do not know?" So that is the basis of it, and the examination is also based on our limitations. This particular slide is to explain the pattern of exam we are facing. It is not a formative test where we have been progressively improved. It is not a competitive exam as your national entrance examination. It is a summative exam just to decide whether the candidate can be passed or failed and how much mark he can give. In which case, there are a good set of questions. There are also not so good set of questions. I'll give you an example of each. What are the variations of Schiff's reagent? Supposing pass is your string. But then there have been some examiners who asked this question also. When was this method identified and by whom? What is the importance of it? Where is it not reliable? Putting a negative in a question is a bad format. Supposing it is an organ, why do you say it is spleen? Instead, again in a negative way, why can't it be liver? So you people should be exposed to all kinds of questions. And I feel that if you familiarize yourself with the procedure or the organs, I think you will be able to get over this. Most of the slides that we get will be having a definite pattern. Always it has to be reproducible. It has to be identified by most examiners, and it should have a specific diagnostic feature. As in this case, I'm not going into the intricacies of it. It is a papillomatous lesion. There is a hyperkeratosis, and I'm finding some bullous lesion over there. Fine. This is of great importance to us. Many students do not know this truth. 50% of the slides will be new to you because the examiners have collected them over a period of time and they are giving it to the students. That is why pathology is a very tough exam. 50% of the slides are non-neoplastic. Here again, the students tend to make a mistake. They overjudge the neoplasm and overdiagnose. You will be given opportunistic infections, fungi, or any of the storage disorders, sarcoidosis, so on and so forth. The slides will be finalized by the examiners in consensus. They will be scrolling through the slides, they will be seeing them, and then finally they will be preparing one set of slides for the students. Sometimes, if it is very simple, be careful. There will be a double lesion. We had, for example, a slide of filariasis with a tumor deposit. Or if it is going to be a sickle cell anemia, it can be sickle cell with thalassemia. A double lesion is always probable. And it is not possible for all of us to make all the diagnosis correct. There will be a discussion during which time they will tend to give us a clue. We should be prepared to take that up. That is why we should be a little relaxed and not too perturbed or anxious about it. After all, many of us cannot get everything correct. This is one thing. A specimen is given and they all know, that is the examiners, that you already know the answer. The specimen has been selected from your center. The student has got the access to it. Invariably, he will be knowing the diagnosis. They write it correctly. But they will be asking you the questions like this. Why do you say it is ovary? Name the bilateral tumors. What are the solid tumors? What are the cystic tumors? What are the solid and cystic tumors? What is the collision tumor? So on and so forth. You find that there can be a battery of questions which can be thrown at us. Now that you people already know the diagnosis, it is our business to go back to the book and prepare that one thoroughly. And secondly, on a gross specimen, do not give a perfect histological diagnosis. That is again a definite suicidal answer because somebody has given you the clue or you are already seeing the list. Most of the diagnoses are post-biopsy wisdom. What are the best and the worst in the examination? The overall pass percentage is 50. Initially, in the first slide, I had shown you the distribution of the marks. Passing in each exercise is not mandatory. Those days, if we do not do that well in the slides, the student is definitely failed. But here it is not probable. It is theoretically speaking, a student can get 0 in a section and still pass the exam. And there is always a chance of passing through grace marks or passing in grace. And secondly, you can always be distinct by getting a distinction. I would advise you people to go in for the last one. And please do understand, however much they ask you the questions and the compartments are, it is an overall assessment by the examiners that matters. Pedagogy and your final viva might or might not interfere with the practicals. Still, after all this, a subjective element persists. That is why always one of the first impressions will be the best impressions. The internals, we all know you for a long time, but the externals are seeing you for the first time, and in a matter of 2 days, they are asked to judge a candidate, which is extremely short. There are some controversies on classification, whether it is going to be an autopsy or a gross specimen, or sometimes a slide, you will be asked the classification. There is always a molecular basis, what is the latest method of classification, etc. But still, this is something that I developed, ENMSUT, epithelial tumors, non-epithelial tumors, miscellaneous tumors, secondary, unclassified, and tumor-like lesions. You should be strong in your basics, and later on you can build higher floors on that. Do not straight away jump into the molecular or the genetic basis of classification. It might be difficult for you to classify, except unless until it is routinely used in the mode of diagnosis. For example, lymphomas or carcinoma breast. What are the markers for ovarian tumors, etc. This is one section, the histopathology. There will be the histopathological technique. Sometimes the examiners might ask you to cut a section and then stain it. Or sometimes you will be provided with a slide which you are asked to stain. There will be the H&E staining, and then there will be the special stains. You people should be familiar with the list of special stains that is being given in your center. The PAP stain is usually given, the reticulin stain, the hemosiderin, or you will have to do the Pearl's Prussian blue, PAS, Mason strichrome, weight fight ferrochrome stain for the lepra bacillus. These are all something common, and you people should make an exact list of it and study those things thoroughly. I had already given you the sources of it. Kindly go back to the book, prepare the notes. If you are asked, if you are given a particular slide, then you will be battered with questions on that. For example, this is there. What is the temperature of the water bath? A very common question. Then what is the melting point of wax? What are ribbon sections? So there will be hundreds of questions that is probable the student can be impounded with within that time. And since they will have to ask us multiple candidates, we have got very little time on our side. To my opinion, the larger or the higher the number of questions that you answer, the greater is the probability of you succeeding. You have been at the peripheral postings also. So some of the peripheral postings can be included in the questionnaire. For example, the blood bank. This can happen typically in a viva or when you are given a Coombs test or a blood grouping. Various things can be asked. And so also the various biochemical values and so on. What are the various investigations that you people do in a case of diabetes? What is HbA1c? What is the fasting blood sugar? How do you confirm a diagnosis? What are the complications of diabetes? So the questions will flow like this. And be careful in this juncture. It is my responsibility to say, please read up the the microscopic changes in the urine. The microscopic changes students usually omit, but there are some examiners who are very keen on that and ask questions on that. What are the various casts? What are the various crystals, etc. And Generally, these are all questions which will be mostly relevant that will be asked, not out of the way. What is the latest method of diagnosis and so on and so forth. Dear students, look at this slide. Tell me your diagnosis. This is a little weird. I'll put up the diagnosis shortly, and you people might wonder the reason. It is supposed to be an extranodal mantle zone lymphoma. How is a student expected to make this diagnosis in 5 minutes? That is why in an earlier slide I said there will be a slide with a pattern. Many such diagnoses are post-immunohistochemical diagnosis, and it would have been arrived at after a lot of discussion, lot of reference with the books and so on. So such slides will definitely not be given in the examination. Even if an examiner provides it, the others will remove them. It should not be controversial. And in this case, it has to be confirmed by IHC. There is no definite pattern. It is not easily diagnosable even by the other examiners. And it is unrealistic to make a diagnosis in 5 minutes. So do not worry about such eccentric diagnosis. In case you fail to make such a diagnosis, you need not be bothered at all. Instead, again, I've given you a couple of examples. In this one, it is a clear-cut case of a recall, dot and dash, and this is supposed to be a histiocyte. The diagnosis can be a Kala ulcer. Whereas in this, I am finding a lot of spindle cells in a whorled pattern. This can be a spindle cell neoplasm, but then it happened to be a nodule at the elbow, and when we did a weight stain, it turned out to be strongly positive for lepra bacillus. It was a histioid variant of Hansen's. Such slides might not be given to you. There are certain observations which all the examiners, me, and the professors have made over a period of time. There is a general opinion that students must be good in all sections. Teachers are vindictive. Passing is a matter of prestige. Intelligent students do better. We must be up to date with the recent advances in molecular pathology. Undergraduate questions are not for postgraduates. Neoplastic lesions will be carrying more marks. These are simply the observations. Now let us see what the reality is. Not possibility to be good in all sections. Teachers are never vindictive. In fact, you are nowhere when compared to them, and you are not a competitor for them. No good teacher will like to fail a student, and no good teacher or examiner will give a misleading clue. This is not fair on the part of the student. Passing is a matter of prestige means 100% pass. That is a very wrong expectations, and some of the students happen to attach a prestige to the pass. This is not a fair expectation. Intelligent students do better. It is not really. It is actually the student who maintains the balance who does it better. And this statement is of course absurd. And it is a gross mistake that undergraduate questions are omitted. As I told you, you might be having a case of a specimen of a myocardial infarction. What is an infarct? What are the types of myocardial infarction? How do you identify an early infarct? Why this question should not be asked? Gangrene foot might be there. What is a gangrene? Define gangrene. What are the types of gangrene? What is a gas gangrene? What is Fournier's gangrene? Questions like this. I don't think it is wrong. So, undergraduate questions should be known at the level of postgraduates. So, please do not omit them. And I have already mentioned that more than 50% of your slides or specimen might be non-neoplastic. The light at the tunnel is not an illusion. The tunnel itself is an illusion. Sometimes that light happens to be a train. So let us be a little careful. Certain things we must know. For example, the special strains, the conventional questions, assembled autopsy, all the manual procedures, section cutting, staining, etc. The classical slides and specimens should be there. Available material. Heart, for example, how do you open the heart? What are the various methods? How do you measure the valve? Or what are all the changes in a case of rheumatic heart disease? Where do you look for the Ashoff nodule, etc.? What is pericarditis? Types of pericarditis. To this panel nowadays, of course, IHC is being added. Earlier it was under desirable to know, but now I would put it under the must know category. All the others come under the so-called desirable to know. There might be a few charts which are again a little difficult, but if you are lucky enough, you might answer them. So coming to the histopathology, they can be asking you various questions, starting from the reception up to the special stain and the diagnosis. So you should go back to the techniques, study them thoroughly. How do you classify hematoxin? What is a progressive stain? What is a regressive stain? There will be battle, an entire battlement of questions. And the source for the answers shall be this. And I'm trying to cover it in my game. Gross and microscopy explained, supposed to be for practicals in pathology. Specimens, of course, you should be careful. There are some specimens which have been collected, which are precious by various centers. Nowadays, examiners are not that very specific. There used to be days when the examiner will be carrying the specimens to the centers. Nowadays, the centers are allowed to display their own specimens. And only thing is, we people should know the probable differential diagnosis. Do not give a correct diagnosis. This, of course, happens to be a hemochromatosis. Then they will be asking you the question, what is hemocirrhosis? What is hemochromatosis? What are the causes for cirrhosis? What are the incidence of malignancy, etc. What other pigments do you know? How do you classify pigments? The questions can go in any direction. Wonderful. What are you seeing on the screen? This is called gravity, taken from the net, of course, and they are given a lot of such designs. It is almost like a ballet dance, and balancing is an art. Why did I say all this? It is for the student to balance between all these. The time, the marks allotted, the practical skill, fluency, familiarity with the day-to-day happenings, interpretation of the specimen, chart, etc., the confidence that we throw, and almost a little bit of familiarity with the recent developments which we might answer with a clue. This recent developments, if you don't answer, you won't be failed, but it is only to decide whether you can be given a higher mark or so. And these are all the things. In autopsy and grossing, for example, these can be asked as questions. I've already mentioned it. You people can go through it. It is just to give you an idea. But I'll just quote one example. In one of the exams, the examiner had come from a center where autopsy was in full flow. And then by the time he was asking the fifth question, the candidate was having the reflex to answer the first or the second question. He was so fast in his questions. So such can happen, and we people should only rehearse. Always try to do the simple things properly. The big things will take care of themselves. Balancing is an art for the examiner also. Until now, we were thinking about the examiner as a very crude and a cruel person. But then a good examiner will be placing himself in the shoes of the student. He should be gradual and deliberate in the questions. Do not dominate. Give the fellow examiners also a chance. You assess the overall performance. Do not be vindictive at one particular exercise. Record your remarks and then give the marks. And the examiners also, it is a word of caution for them. Maintain the documents for a backup. Today, we used to sign all the papers, and This is being maintained with the remarks of the examiners in the university so that if the student unnecessarily goes to court, they are provided as evidence. The distribution of the question should be standard wise and also chapter wise. It should not be on a particular level and at a particular region. Simply asking questions on chalk for half an hour does not mean the examiner is good. And these things sometimes the examiners do. They jump stations. They ask one question, the next question will be totally unrelated. So it will be difficult for the student to have a reflex and answer. And trusting the post-biopsy wisdom. What, you cannot identify even this? This is a lymphoma. Can't you identify it? I would have identified after doing all the IHC. Asking questions that the other examiners also cannot answer. They should be giving, you should not actually give a clue regarding the assessment. You're doing well, fine, keep it up, etc. Should not be done. They should not be prejudiced, be too specific or too compassionate also. Don't worry, it is a problem for all. Such things should not be said. And they should not be too objective or too subjective. These are all certain things for the examiners. And as far as we are concerned, we are supposed to maintain a balance. There is no point in being extremely fluent with all the autopsy techniques and fumbling in clinical pathology. Doing excellently in slides but not explaining the gross properly. We will tend to lose marks. Our performance will have to be balanced. If you are 60%, you should be 55 to 65 in all sections. And these are all the things that will be assessed and analyzed. We will not go by your exact answers. This is not an objective type of question. Your body language, the confidence, the speed, the precision, etc. Definitions are definitions. For example, kindly go through them. There is something called as a rapid fire. As I told you earlier, a student will be given marks based on the number of questions he answers within the limited period of time. If he keeps on dragging the answer for a question, he loses the chance. So if you don't know something, just say pass. But do not say pass for all the questions. So here time matters. We'll be creating an impression. And please do remember, it is neither objective nor subjective. Special stains can be given, and these can be the various types of questions. For example, a pap stain can be asked, and then you will be asked a number of questions like this. People should be prepared. Maturation index, for example, we do not answer. And so on, the questions will be going on. This is again a prototype or the procedure for the pap stain, and the examiners are asking, what is EA36? What is the role of Bismarck Brown? What is aristametoxylin? Can you use anything else? After all, we have got only about 6 or 7 exercises. Who prevents us from reading these things thoroughly? It is a fundamental mistake of the student. If it is for maturation index, what is the stain that I can use? What are navicular cells? So these things only I was saying. You need not mention something about other stains, but the stains that are there for the examination, we should know thoroughly. There are some definite steps to failure. So far I said, it is always a chance to pass. One of the definite steps to failure will be arguing with the examiner. Selective reading. Reading one, omitting something else. This includes theory and practicals. Ignoring the day-to-day applications. You are able to answer the molecular classification of the neurogenic tumors, but you will not be telling me the different methods of hemoglobin estimation. Mismanagement of time, both in theory, so that you answer some questions very well, some you actually omit. And similarly in practical, however much time you are given, you are not able to complete. Omitting questions, as I had mentioned earlier, and this is a big blunder, omitting the UG question, because these will be the core with which will be attacked during our viva OC. And The opposite is also true. There are some students who strive for a perfection. They want to be 100% perfect, that they'll be developing an anxiety neurosis, not even turning up to the examination hall. And when we are not relaxed, we will not be able to take a clue from the examiner. Invariably, they will be giving you a lot of clue. Patient is from Bihar. Al-Azhar is the diagnosis. Genetic. Then it can be a storage disorder. So this is another story of A.J. Cronin, the Citadel. This is a story of a doctor who ascends the ladder. Those days they were very critical. It is an extremely difficult exam to pass in the Oxford. And when he appeared for the examination, the panel of examiners asked him a question and he answered one. And the examiner said, "You are wrong." He said, "Sorry, sir, I am right." And they said, "This is a reference." And he mentioned a reference which was more recent. Immediately they called for that particular reference from the library. They realized that the student was correct and he was given a pass. Please, students, such things will not happen in our exams. If the examiner says something, kindly agree. A seasoned examiner, as I mentioned here, they'll be starting with the dialogue and then they'll be maintaining a congenial atmosphere and they'll be giving the student another chance. They won't be displaying discontent when the student is smart. And here will be some set of wrong methods. Always get used to all of this by conversing. You people can converse with your colleagues, with the junior teachers, so that you people become familiar with the language. After all, it is a language. You cannot learn and talk a language in a very short time. Kindly practice it. Many students make this basic blunder of learning the practicals after the theory exam is over, which is a very, very, very big mistake. It reflects in the practicals. Again, questions. And this is one quote that I can always like. So greatest fool can ask questions more than the students can answer. So from this, you can imagine the number of questions that can be asked. And the probable list is given over here. Any number of questions can be asked. So we should be flexible and the diagnosis alone does not matter. Define a polyp. What are the types of polyps? How do you classify polyps? What is a serrated polyp? If you happen to be a very bright student, they would like you to get a distinction. Then they might ask you such questions. What is the minimum number of polyps that you should have for a familial polyposis, etc. Also, please remember that the examiners are quite compassionate and humane. This is one instance. Relax. Please identify the specimen. The student, you can see the state of the student. He is blinking, he is threatened, his hair is thrown out of shape, and then the examiner continues. I'll give you a clue. It is something that you and I do not have. And the student answers brain. So always common sense matters most. The law of probabilities. How many squares are there in this one? Students usually say, or rather anybody will say that there are 64 squares. And see what I'm going to draw next. Now, this is also a square. This is also a square. This is also a square. The whole board is also a square. So you find that there are more squares than we actually see. The idea or the message that I want to convey is there is an entire array of questions that can be thrown at us. It is a case of a typhoid ulcer. The questions can be regarding typhoid or a differential diagnosis. How do you distinguish between the benign and the malignant ulcer? Or it can be regarding the microbiological diagnosis of typhoid also. Amoebic ulcer, why is it flash-shaped? It can go on in whatever way it is. Only thing is, having known the diagnosis, that is why I get very upset with the students. You people know the specimen, you people know the procedure, but then you don't do the adequate homework on it. Start doing at least now. So this is a shift one and probable question that can be asked. There can be hundreds of questions. Try to rehearse with your colleagues and the junior doctors. OSPI and OSCE charts have been given nowadays. So in our center, we have got all these. And finally, the examiner will be finalizing any of this. They will be choosing some of the slides that are or the charts that are available. And it is given. It is incidentally a case of a Tay-Sachs disease showing a lysosomal storage. My only request to you people, you will again be knowing these charts. Kindly read them up thoroughly because Tay-Sachs disease can be asked as a theory question. So also SLE, also immunofluorescence, also the chromosomal abnormalities. So kindly do it hand in hand, your performance will become excellent. This is one. Pedagogy is supposed to be an art of teaching where here again we should be careful. Generally, we are given a topic, we prepare very well, but we must realize that the examiners are members of the medical education department in their institute. And they will be asking you, what is your experience in teaching? What are the methods of teaching that you follow? Can you make a list of the other methods that could be followed? What are the teaching media, etc.? Methods of assessment. And you might be given a topic of your choice. For all this, I would like you to start now, get the help of the teachers and compile all the questions and answers so that you are able to answer well. A small group teaching, large group teaching, etc. Integrated teaching. And this is, again, the exam is not going to be like the present situation. And the examiner is not like Russia. And we are not like Ukraine also. And when you go for the Viva, you people should realize the exam is almost over. You should be in a relaxed state of mind. It is more of an interview. In which case, again, the thesis, you are the stalwart in your thesis. You should be able to explain. A logbook of your activities will be a very good backup. It is a courtesy that we usually ask. What is your desire? What do you want to do? What are the recent developments? Sometimes they ask us for the field where we are interested in. Be very careful. Once we commit, that is our din. They'll be asking us all the questions. One of my own students committed the blood banking, and then the questions were so awful that the student was not able to answer. Passing is different, but we should know what to commit and where not to commit. And I hope this will be the situation. After war, there will be peace always. A beautiful novel by Leo Tolstoy. And we are ultimately going out of the tunnel and leaving the MD course and the examination. I wish you all the best.